Acidosis, or metabolic acidosis, is probably the most important concept to get across to people. And there's a lot of confusion out there. In fact, there's people out there saying, well, this was all debunked, 10 years ago, and it was debunked a couple of years ago. In fact, there was a publication in Forbes magazine criticizing the guy who wrote the major book about it. That's all that was debunked. There are tens of thousands of studies on metabolic acidosis and all the various ramifications of it. And trust me, I've read, not that many, but I've read a lot on them. And it comes back to some basic science. Everything in chemistry relies on a specific narrow band of pH to work effectively, everything. And this is very different to what I've described in the gut. It's totally different. The gut is outside the body, so to speak. This is inside the body, in the blood, in around the cells. And what happens is that every single chemical reaction relies on a really narrow, broad range of pH. And in the blood, it's 7.35. And what it is every time we eat, every time we metabolize, every time we breathe, every time, it's a fine tune between making sure we keep that 7.35. So the body has two major mechanisms. There's a half a dozen in total, but there's two major mechanisms. Breathing is one. Now, breathing is very alkalizing. So every time you take a deep breath, what it's taking in is it's taking in the oxygen and it's getting rid of the carbon dioxide, carbonic acid, and it's eliminating out of the body, and it's alkalizing. And that's a really rapid, fast one. So when you're doing any form of sport, you will get a build-up of acid in your muscle, that lactic acid, sore muscles and so on. And as a result of that, you become very inefficient and sore and you can no longer do it. So your body gets the oxygen down there and carbon dioxide, carbonic acid out of your breath, and it rebalances it really quickly. The major one that we're dealing with here today is the kidney axis, so the kidney acid alkaline balance. And the kidneys are the major organ for eliminating acid out of the body. Now let me explain this all, and I'll come back to that. Essentially, we've got foods that are alkaline, and everyone's heard of the alkaline acid-based diet and all those things, and it's very valid. It's very valid. When we've got minerals that are alkaline, and calcium, magnesium. And as we go down these, you'll see the calcium, well, you're told you don't have enough calcium. Magnesium is in all your green veggies and you're not eating enough veggies and nuts. So already you can see, hold on, maybe we're not getting enough of these alkalizing minerals. Then you've got sodium. Potassium is in all your fruits and your veggies as well, so we're not getting enough of those. Zinc, you don't get enough of. Iodine, well, you don't get enough of. And boron. So at the end of the day, what's happening is these alkaline minerals, we're not getting enough of them. And as a result, we tend to be weighted on this acidic side over here. Now, you've got your acidic minerals, ones like phosphorus, sulfur. You'll notice chlorine, because you get an excess of chlorine nowadays because it's in all the water. You get an excess of fluoride, and you probably get an excess of copper in most cases because of the copper pipes that exist. So we're getting excess of acidic conditions. Now, on top of that though, what we've got is a lot of conditions that lead to an increase in acid forming. And remember, the body wants to keep it balanced here. So to balance it, it uses the minerals and the alkaline balancing systems. And the first one is metabolism. Every time you metabolize, you're producing an incredibly small amount of acid as a byproduct. That's just the process. That's really good. That's necessary. It's essential. Unfortunately, the body has to get rid of it. Now, if you're exercising more and doing more, then you have to eliminate more. And that's why you breathe a lot more when you're exercising. And of course, that's why if you're an athlete and you want to improve your performance, again, mention this later, many athletes take sodium bicarbonate as a supplement pre-exercise workout to give them a little boost to help alkalize that acidification that occurs. So if your muscles are cramping a lot, then you probably need to do something about that, alkalizing it. You've got all the food additives, which are in food. Meats are a contributor to the acid formation in our body. Not a major one, but they are a contributing form. And so what we need to do is, okay, look at those and rebalance them with all the other things out there. Dairy, absolutely. Sugar and grains are the two single biggest independent sources of acid forming products in our body. And so what we really want to do is get rid of sugar and get rid of grains. And so you can already see that this is already weighing up towards the acid side. And as a result of that, we're building up more and more of the acid in our body and not able to get rid of it with the bicarb. And so we've got the grains there, alcohol, smoking, stress. These are factors of the 21st century. So in the 21st century, you have got a lot more acid forming products in your body as a result. Now, of course, we can test this quite easily. I'll show you at the end. But we've got a lot more acid forming. So make that assumption. So if we come back to here, how does the body balance it out? Well, we've got a couple of stores in the body, in particular bicarbonate. And something like sodium bicarbonate, I've talked about it. You've seen my video on bicarbonate. Please subscribe below. Check out my other videos on this because it'll give you a much bigger, rounded understanding of what's going on. In all of your cells to do with your digestive system, for example, you have a small bicarbonate store. You have it in your stomach so that your hydrochloric acid that you release for digestion doesn't literally burn out the inside of your stomach. Our saliva, we have a bicarbonate store up in our saliva so that our mouth produces a pH of around about 7. Then we've got in the kidneys, and that's our kidneys is our biggest one and our biggest regulator of the acid-base balance. And so what your kidneys want to do is get rid of the acid as much as possible and hold on to that bicarbonate and recycle the bicarbonate, except that can't always happen. And so again, we've got here, and then we come across here and we've got our acid stores. And unfortunately, our acid stores are what we will often cause or call pain, because your body doesn't really want to store it, but it wants to get out of the blood. And it has to get out of the blood because everything has to function properly. So it will draw on whatever it can to alkalize or keep that pH balance perfectly at 7.35. So for example, it will draw on, in the long term, it'll draw on calcium and magnesium from the bone just to make sure that the blood pH remains at 7.35. Now that's a longer term one, and obviously it's saying something that if you've got bone issues, then you've probably got a pH issue, which is what I'm trying to explain to you. That's one of the mechanisms. But the other way that the body deals with it is that it stores them as crystals in various parts of the body. And these crystals, you do know, they're called kidney stones, and they're called uric acid, gout, and even artery calcification. So what happens if your arteries, your blood is a little bit acidic, okay, and your body says, okay, I don't want it acidic, what do? I drag some of the calcium off the bone, and when the calcium interacts with the acid to alkalize it, the calcium forms a plaque on top of the arteries. This is the simplest explanation of a very complex process, but it shows how simple it can be. And so your body is doing whatever it can to keep you alive right now, and it's not worried about what's going to happen in 5 or 10 or 20 years' time to do with your bone density. It's worried about keeping this perfect balance here now. And as a result of that, your body has long-term health consequences. Our diets and our lifestyles are overwhelmingly acid forming, which puts pressure on all of the systems because of that importance of that balance out there. And overwhelmingly, tens of thousands of studies now demonstrate the role of metabolic acidosis, this subclinical metabolic acidosis, in all the forms of chronic illness. Now, I've just written up a little summary here of some of them, but I want to explain that when I've got something like cardiovascular disease or metabolic syndrome or bone density, what they've done is in the large populations, they've gone in and said, okay, what are the levels of acid in the urine of these people who have low bone density? And they find they have low levels. Then they go in and they do the experiments on the mice and they see what happens, and it interferes with the bone density. Then they do the experiments on humans, for example, and treat them with bicarbonate and something else called potassium citrate, which is converted to bicarbonate. So these aren't just a one-layer study. These are 3 or 4 different levels of studies that support each of these. So not just thousands of studies, but different types of studies. And the first ones overwhelmingly show a link between cardiovascular disease and metabolic acidosis. And so the first consequences is, if you want to lower the greatest risks we have in our society for dying as a result of heart attack or stroke, cardiovascular disease, then you want to lower your metabolic acidosis. And the first thing people say is, but will that increase my high blood pressure? Well, the studies actually demonstrate it does the opposite. People with high blood pressure have higher levels of metabolic acidosis. And so when they lower it, it helps lower blood pressure. But remember, everybody is different. So when somebody asks me in the studies, because the studies are done on big populations and so on, it's about understanding that you're an individual. Measure and monitor your blood pressure as you go and see how you go. But from the big studies, it overwhelmingly shows it lowers blood pressure. Also helps to unblock arteries, so decalcify the arteries. And a lot of people have been told you can't do that. Well, you can. There are studies in terms of nutritional strategies and programs, and certainly bicarbonate, sodium bicarbonate, has been used in decalcifying the arteries. Metabolic syndrome, all of the various aspects, fatty liver, weight gain, obesity, all those, insulin resistance, all show a direct link with metabolic acidosis. So again, lowering the metabolic acidosis using bicarbonate therapy, and of course a good diet and lifestyle. I'll be posting a lot more on diet and lifestyle and metabolic acidosis, so make sure you subscribe to the channel below, my channel, and as I put this up, you'll be informed about it so you can keep up to date and work out what you can do and how it fits in with you. But coming back to it, so we've got your insulin resistance, all your metabolic syndrome indicators. When they actually create insulin resistance in mice, metabolic acidosis increases instantly, and vice versa. When they literally inflict mice in a state of metabolic acidosis, their insulin resistance changes too. So the message is, we know from both sides of the equation. Then you've got the immune function and viruses and cancers. You may not be aware, but viruses produce an acidic environment. Now here, there's a half a dozen studies on metabolic acidosis and COVID even. But prior to that, influenza A and various other viruses, including malaria, demonstrate a link between metabolic acidosis and vulnerability to viruses. Viruses actually, like cancers, need an acidic environment to be able to replicate efficiently and take over to become the problem that they do. So one of the simplest strategies that they're looking at in all terms of viruses is actually alkalizing, use bicarbonate as an alkalizing therapy because it is so useful. Nervous system problems, bone density is probably the one that stands out without a doubt in terms of thousands of studies linking bone density and your net consumption of acid in the diet, the acid forming foods in your diet, and your literally metabolic acidosis in your body, your urine showing up, and bone density. And again, same with animals. When they increase metabolic acidosis in animals, they stop building bones and they start losing bones. So there is a direct correlation, direct measures of all the science showing exactly the same, including osteoporosis, kidney stones and gout. I've talked about a couple of times already. And I've got a lot of information in my other videos on gout and kidney stones. And it all comes down to looking at those alkalizing minerals and, of course, bicarbonate therapy. Aging. Interestingly enough, there's a whole raft of studies demonstrating that as we age, and here we're talking probably post-65s and so on in people like me, it means that we actually, a lot of those signs and symptoms of aging are quite familiar or quite similar to those of being on in a state of metabolic acidosis, and bicarbonate therapy has been able to reduce that. And in my studies where they had the mice and they literally got the aging mice and exhausted them and gave them the food so that they had metabolic acidosis, they were fatigued and so on, then they gave them bicarb therapy and it reversed that totally and instantly. Now, I know lots of individuals who have been to my talks over the years and they've said, hey, hold on, you've suggested taking a little bit of magnesium and some of those minerals and some bicarbonate therapy, and I can't believe the difference it makes in terms of my energy as they're aging. And this is also in terms of cognitive dysfunction and fatigue, particularly with aging, although there are also some studies now linking ADHD and metabolic acidosis. And so the value of bicarbonate therapy in there. The great thing about bicarbonate therapy is it's simple, it's cheap, it's effective, it's easy to measure and monitor, and it's just simple. It's simple. And the basic concept of science is go for the simplest explanation first. And then finally here, but not, this is just a summary of it, physical fatigue and pain. And bicarbonate therapy has been used in people with arthritis, because people with arthritis, rheumatoid osteoarthritis, are typically in a state of metabolic acidosis, or low-level metabolic acidosis, and people who are treated with bicarbonate therapy see signs and symptoms of arthritis, including the pain and or back pain associated with metabolic acidosis disappearing. So there's a whole raft of these studies out there, and as I say, I find it interesting that it's not the single first thing a doctor should be testing you for on a regular basis, because it is so simple and so easy. Now, here is where it's used actually medically. So these are the scientific studies, and they've got lots of studies showing it. Here are some of the specific treatments they've developed in cases of severe conditions and so on, like epilepsy, gallstones. It's used medically for gallstones, kidney stones, kidney disease, gout. It's used as an adjuvant therapy, an additional therapy in cancer treatments, because cancers produce a very acidic environment, and they find that when they do the treatment and add the bicarb in with that, it has better outcomes, because the chemotherapy and the radiotherapy and the cancers themselves are very acid forming, very metabolic acidosis in terms of what they create. So and the results show that with chemotherapy patients who are having the treatments along with the bicarbonate therapy, it works much more effectively and much less side effects as a result of it. Alkalizing drugs, there are a lot of drugs that can cause acidosis. One of those, a major one, is methotrexate, which is used, I think, with arthritis and pain and so on. Again, these are used as an adjuvant with these to stop the side effects of these drugs along the way. And there's even some conditions of difficult childbirth conditions and so on, where they officially recommend using bicarbonate therapy. So my message is very, very clear. Bicarbonate therapy is well established in medicine. Bicarbonate therapy is extremely well researched and understood in the scientific health world. So the question is then, how do you find out what level you are, and do you need bicarbonate therapy? Can you change it? The question then arises, how do you test yourself? Now, I've already covered this in some of my other videos, so go back and have a look at those. I'll go over it very briefly for you now. But also check out my big video on bicarbonate and the bicarbonate store, which support and build up in this whole bit of information I'm describing to you. But this is typical a pH paper that you can get online, and they cost about $10 online. Just go Google. I don't have any affiliation with any organization, so I just tell you, go online and get them, and you want a pH that's going to be around about 7. So it'll usually be about 5 to 8 or something like that, in that range. And you get them and then you test it. And the simplest way, there's 2 tests that you can do. And the first one is the saliva test. Now, the saliva test is taken any time away from food, because what happens is, as soon as you've eaten food, you will get the influence of the food in terms of the level of pH. So let it digest, get it out of your mouth. I wake up in the morning, I just do it first thing in the morning. It's the easiest way, a big bit of saliva and a spoon, and I just put it, literally dip the end of the pH strip in there and leave it in there for about 5 or 10 seconds, read the instructions on it, and then out comes the color, and it tells me my pH of my saliva is about 6.75, which is ideal. So that's my saliva test. Saliva will vary very little. Okay. Now the second test, and remember this one's 10-15 minutes before a meal, away from a meal, but first thing in the morning is best. The second one is your urine test. And we're looking for the same level again, 6.5 to about 7. But what happens is if you have it after a meal, say a half an hour to an hour after a meal, you have the influence of that meal. So you'll see it will go up and down a lot more. So if you've just had a little teaspoon of sodium bicarbonate, half a teaspoon of sodium bicarb mixed with water before a meal, before you wake up first thing in the morning, then it's going to show up and it'll be a pH of around about 8. So what you do first thing in the morning, get your pH strips, get a little bit of urine on them. Obviously, you read all the instructions on what it means, then compare the levels and see what level you're at. And again, you're trying to get to as close to 7 as possible. Now, if your level is between 5 and 6, then you need to do a lot of work on that. And again, watch those other videos in there. Now, I would also recommend that you speak to your GP about this, because your GP, your health professional, any of the health people you're working with will understand this and be able to share the information. Although they probably don't understand the depth of the information that is available to you. So some really simple strategies here. Please make sure you follow us on YouTube, share this information. This is probably the simple and easiest, most effective thing people can do for their health straight away.